I'm Christine Cartwright at Central New Mexico Community College. This is CNM Glass, Lesson 10 of Medical Terminology. Our first word today is a little bit different. You'll know when you think about it that it makes sense. And that is rage. I like to think of this, if you put heme together and RRHAG, you have hemorrhage. Except for I can't spell it. But when you think of a hemorrhage, you do think of blood bursting forth, someone bleeding very rapidly, and that's a hemorrhage, a bursting forth of heme, blood. Sorry, I can't spell that. The next one's kind of interesting. And again, you'll know this one if you think of it. And this means flow. If we think of diarrhea, it's really just, we're talking about dia, remember, is through, flow. It is flowing through. Your bowels are, everything is just flowing through from your mouth and out the other end. So a patient who has diarrhea is experiencing a flow through. We're not going to cover the term for menses, menstrual period, but you may have a patient who's in for surgery, probably for a hysterectomy. Go back and think about what that is. A hysterectomy for menorrhea, too much flow during their cycle. Or a woman who has already been through menopause is said to have amenorrhea, a without their menstrual flow, which we expect for a woman in her later years, but that's an abnormal diagnosis in a younger woman, and usually they'll start to look at the reason for amenorrhea. Can you think of the most common cause? I hope you came up with pregnancy. That would be the most common cause for amenorrhea, but there are other medical reasons why someone might be experiencing without their menstrual flow. A few lessons ago, I gave you some terms for blood vessels, and here's a couple of more. Vena means vein, and vaso means vessel. So there's a lot of terms that you're going to hear, vasospasms, and I think spasm is one of our words we'll get to a little later. Vena cava, you're going to hear a lot of terms related to the circulatory system. Here's one that you, being from New Mexico or living in New Mexico, might know. Xer is dry. So everyone here is trying to do the xeriscaping, low water planting, because we live in a dry climate. If you work on a cancer floor or post-op units, you might hear a patient with xerostoma. Stoma is that mouth, and xer is dry, so it's just the medical term for having a dry mouth. So if we haven't done it before, let's go ahead and put stoma. Now I know you're thinking, well, we've learned stoma when we have an ostomy, that surgical opening that's created is called the stoma, and it is. Really, the term mouth does not just discuss this thing that we speak out of. A mouth is an opening into something. So that is like the mouth, the entrance of the intestines. Plast is the surgical repair of something. So when you hear your patients who have rhinoplasty, a nose job, abdominoplasty, they had a tummy tuck. When you see plast or plasty, it is the surgical repair. Remember, we will often at the end or to join two words like put a connector letter or put a letter on the end. It makes it sound normal in English. It is used just as a filler and ender, okay? So you'll see O a lot between Y a lot at the end. Plasia is our next word, and it's the development. So again, I'm going to go back to one of these words, dys, okay? Dysplasia is bad development. So when you have a patient who came in, they may have had a tumor, a mass, and they talk about dysplasia of the cells, they're looking at that bad development of the cells and looking to see if they're cancerous yet, if they're on their way to cancer. Two similarly related words is spas, which is to pull or draw, and spasm, which is the involuntary contraction. So you may have a patient with spasticity. One side is pulling together or drawing together. Their muscles are spastic. You get in report your patient has a spastic right arm and it cannot be straightened. It has pulled together. It has drawn together. Whereas a spasm, it does pull together, it does draw together, but it's an involuntary contraction. So sometimes people will have muscle spasms where the muscle tightens and involuntarily contracts. Skull means curved, and you're going to hear that a lot with scoliosis. So go back and remember your osis, your any condition of being curved. And really, we talk about scoliosis of the spine, people who have the curved back, the curved spine. Pod is foot. So think of the podiatrist, okay? The doctor who takes care of the feet. Retro means backward. You'll hear this sometimes in doctor's dictation where the scope was retroverted. Sometimes women will say they have a uterus that's tipped backwards instead of tipped forward. It's called a retroverted uterus. When you see somato, it just means body. So somatoform, somatic, psychosomatic illness. Have you heard of that? Psycho, mind, body, illness. Our minds greatly affect our bodies. And sometimes people use psychosomatic to mean there's nothing really wrong, but a patient's complaining of pain, and that pain has arisen in their mind, causing the symptoms in their body, instead of the body causing symptoms being interpreted in the mind. Valve is roll. So you may hear of a volvulus in someone's intestine, where the intestine has rolled, twisted, tipped in on itself. Pect is chest. So these are all those guys working on their pectorals at the gym, trying to get the nice big chest muscles. Tegument refers to skin. Integument, your integumentary system. Tegument is skin. The last one for today is proct, and that refers to the anus. So everyone makes a lot of jokes about having to go to the proctologist. Really, when you are looking at diseases, cancers of the anus, other anal issues, sphincter issues, you're going to see proct in front of that. Okay, this has been lesson 10. You will have an activity today where you're going to combine all the things you've learned up until 10 and look up some terms online. Hopefully somebody in your group that you're assigned has access to a laptop, your iPad, your phone, because some of the things that you're getting ready to go into clinicals now are terms you need to start being able to put together and know what type of procedure your patient is having done.